You know that feeling, that little flutter of anxiety, maybe even a bit of dread, that creeps in when you think about your next dentist appointment.
Yeah, definitely.
We're told consistently that we need to go, ideally every 6 months, that it's, crucial.
Mm-hmm.
And yet, for many of us, life gets busy. Or maybe the thought just feels a little uncomfortable.
It really does. It's a
Yeah.
place focused on something so fundamental to our lives, our teeth, our smile, our ability to comfortably eat and speak. But the experience itself can often feel mysterious, maybe even a little daunting.
That feeling is incredibly common, isn't it?
It really is. Despite the importance of dental care, it's often an area of healthcare that's surrounded by, well, apprehension.
Yeah.
And honestly, I think a big part of that anxiety comes from not fully understanding what's happening, the tools being used, or even the language the dentist or hygienist might use.
Exactly.
Demystifying the process, understanding why everything is done, can really transform that feeling.
Absolutely. That's exactly what we're doing today. We're going to take a deep dive right into the world of dentists, dental visits, and everything related to oral health.
Okay.
We've pulled together insights to really illuminate what goes on when you find yourself in that dental chair.
Good plan.
Our goal is to explore the words you might hear, unpack why caring for your dental health is profoundly connected to your overall physical well-being, and even peer into some really surprising advancements that are shaping the future of dental care.
Think of this deep dive as your guide. Our mission is to walk you through the experience, explain the key players and processes, and give you a much clearer, more informed perspective on what's happening.
Right.
By the time we wrap up, you should feel significantly more comfortable and knowledgeable about your next dental visit, understand the essential role of proactive dental care far beyond just aesthetics, and hopefully that little knot of nervousness might just, loosen up a bit.
That's the hope.
It's truly a shortcut to being well-informed about a vital aspect of your health that impacts your daily life in so many ways.
So let's get started by setting a scene. Let's imagine a scenario, based on some of the material we looked at, that paints a picture of a patient walking into a dentist's office. Our patient is named Gary.
Right. Gary arrives, and it's clear he's not having a good day. The sources describe him in quite a bit of pain, a really severe toothache, so bad he's finding it impossible to eat anything.
Oh, wow. That sounds rough.
Yeah, and visually it's apparent something is wrong because his face is notably swollen on one side.
Okay.
Gary has a suspicion that his wisdom teeth might be causing all this trouble. He's in discomfort and looking for answers.
When a patient like Gary comes in with such clear symptoms, the first step for the dentist is to understand what's happening from his perspective. And the dentist starts with a very standard but incredibly effective opening line.
Yes, the dentist begins by asking, what seems to be the problem? This phrase is perfect in this context. It's highlighted as being a very easy, polite, and entirely natural way to initiate a conversation about someone's issue. It's fluent and universally understood, serving as a clear, open-ended invitation for the patient to explain what they're experiencing.
Kind of gets the ball rolling.
Exactly. It immediately puts the focus on the patient's discomfort and history.
It sets a helpful professional tone of inquiry. So Gary describes his severe toothache, the swelling, his suspicion about his wisdom teeth, and the dentist needs to transition from listening to actively assessing the situation.
That's where another common professional phrase comes in. The dentist would then say, well, let's have a look.
Right.
This isn't just limited to dentists. You'd hear a mechanic say it about your car engine or a doctor before an examination. It's kind of shorthand for let's examine the issue physically and see what the problem is firsthand.
Makes sense.
It signals the shift from just talking about it to actually looking.
So the dentist directs Gary to open wide, the classic instruction we're all familiar with. The dentist begins the examination, looking inside Gary's mouth, feeling around. And based on that initial visual and perhaps tactile inspection, the dentist forms an initial impression, often summarized in a phrase that, while simple, conveys significant meaning in this context.
And that phrase is, this doesn't look good. Now, it's important to understand the nuance here, as the sources point out.
Okay.
While you could literally say, this doesn't look good about an object if you found it aesthetically unappealing, like an ugly chair or something.
Right, like I don't like the look of that.
Exactly. But in this situation, and frequently in professional contexts, it's used to describe the situation or the prognosis.
Ah, so it doesn't mean Gary's teeth are ugly. It means the situation itself presents problems or challenges.
Precisely. It indicates that what the dentist is seeing suggests complications or significant issues that will require attention.
Okay.
The sources give several excellent examples to illustrate this situational meaning. You might say, it doesn't look good for me getting that job if the interview went poorly.
Right. Or things don't look good for him if someone is deeply in debt or facing a difficult challenge.
Exactly. We even hear it used broadly for large-scale issues, like the economy doesn't look very good, meaning the economic situation is problematic.
Gotcha.
So when the dentist says it after examining Gary, they're immediately conveying that they see signs of significant issues requiring intervention.
And what specific issues did the dentist identify based on this initial look, according to the scenario?
Based on the sources, the dentist observed two immediate problems. Gary had a noticeable cavity, and importantly, an existing crown on one of his teeth was loose.
Okay, so a new problem, the cavity, and a problem with a previous restoration. What's the immediate plan suggested by the dentist in this scenario?
The dentist indicated that the cavity needed prompt attention. They would need to place a filling to repair it and prevent it from getting any worse.
Which they tend to do, right? Get worse.
Oh, absolutely, if left untreated. And the loose crown would need to be refitted, essentially cemented or put back securely into its proper place on the tooth.
Immediate issues addressed. But as we know, a surface look isn't always enough to understand the full scope of the problem, especially with teeth.
Exactly. The sources mentioned that the dentist also decided to order some x-rays. This is a standard procedure to get a view below the gum line, inside the tooth, and at the surrounding bone structure.
Right, see what's hidden.
Yeah, it allows the dentist to see hidden problems that aren't visible during a surface examination, like cavities between teeth, issues with the tooth's root, or problems with the wisdom teeth Gary suspected were involved.
And then comes the question many of us ask, often with a bit of trepidation, especially when we're already in pain. Gary asks, is it going to hurt?
Ah, yes, the million-dollar question. And the dentist's classic reassuring response is, no, not at all. Just lay back and relax.
Famous last words sometimes.
Well, this is often followed by the instruction, okay, spit, usually after rinsing. The sources included a small, relatable piece of commentary here, acknowledging that despite the dentist's best efforts and the aid of local anesthesia, many people feel that sometimes, particularly with complex procedures or when you're already sensitive,
Yeah.
the experience can feel like it hurts a bit more than that initial reassurance might suggest. It's a common point of connection for dental patients, I think.
It absolutely is. That resonates with many experiences. So that scenario gives us a snapshot of a dental visit dealing with some specific problems. Now, let's take a step back and really unpack some of the specific language used, making sure we're all on the same page when these terms come up.
Good idea.
Understanding the vocabulary is incredibly empowering.
It certainly is. Feeling lost or confused by the terminology can add to any anxiety you might feel. Let's break down some of the key terms.
We heard toothache in Gary's situation.
Toothache. Simple enough, right? It means a hurting tooth. The structure of the word is common in English. The ending ache indicates pain, as you see in stomach ache, headache, or even backache. It's a direct way to describe localized pain in a tooth.
And x-ray, which the dentist ordered for Gary.
An x-ray is essentially a picture of your bones, or, in dentistry, your teeth and jawbone. It uses a specific type of electromagnetic radiation to create an image that reveals structures hidden beneath the skin and tissues.
Okay.
You'll encounter x-rays at both the doctor's office and the dentist's, and they're crucial diagnostic tools for seeing things like fractures, foreign objects, infections, or, as in dentistry, cavities between teeth or issues with roots and bone density.
Got it. Let's dive a little deeper into some of the more specific language takeaway terms from the sources, starting with something Gary was visibly experiencing.
Swollen.
Swollen. Right. It's an adjective describing something that is larger than its normal size, typically because of fluid buildup within the tissues.
Like Gary's face. Exactly. His face was swollen due to the infection or inflammation from his tooth problem. The sources provided some memorable examples to illustrate this. A humorous exaggeration like a swollen nose the size of a football, which paints a picture of extreme swelling,
Right.
or the practical advice of putting ice on a swollen foot so the swelling goes down, which introduces the noun form swelling, referring to the state or condition of being swollen. And the verb form is to swell up, as in my hand is swelling up after that spider bite. It's a common physical reaction, often the body's inflammatory response to injury, infection, or irritation.
Got it. And Gary suspected his wisdom teeth.
Ah, wisdom teeth. These are quite well known for the problems they can cause.
Mm-hmm.
The sources explain these are the very last molars, the final teeth to erupt in the mouth.
Way in the back.
Yeah, way back there. They typically appear much later than other adult teeth, usually somewhere between the ages of 17 and 25.
Hence the name wisdom, I guess.
That's the idea. The name is a bit of a linguistic curiosity. They are called wisdom teeth because they emerge around the age when a person is traditionally thought to be gaining wisdom. Of course, the teeth themselves aren't wise.
Right.
They are located right at the back of your mouth. Because they come in so late, there often isn't enough room for them to emerge properly.
Ah, okay. That's the issue.
That's often the issue. They can become impacted, meaning they get stuck partially or completely beneath the gum line or against another tooth, or they can push on other teeth, causing pain, infection, or orthodontic issues. This is why they are frequently removed.
That explains why so many people have stories about getting their wisdom teeth out in their late teens or early 20s. Next, a word that strikes fear into the hearts of parents and kids alike. Cavity.
A cavity is, at its most basic, a hole in the enamel and dentin layers of a tooth.
Just a hole.
Essentially.
Yeah.
The sources clearly state the primary culprits: consuming too much sugar, particularly sugary foods and drinks, which provides food for the bacteria naturally present in your mouth, and not brushing your teeth adequately or frequently enough to remove those bacteria and the food particles. These bacteria produce acids as a byproduct of consuming sugar. These acids gradually erode the tooth enamel, creating that initial soft spot that eventually breaks down into a visible hole or cavity.
Okay.
The sources noted how common cavities were in childhood, which makes sense given the link to sugar intake and perhaps less diligent brushing habits in younger years.
Makes sense.
One interesting detail shared was how one of the original speakers managed to avoid cavities, crediting their mother's focus on healthy eating and good hygiene.
Ah, the health nut mom.
Right, suggesting that prevention from an early age is incredibly effective.
It really underscores the importance of those daily habits. Moving on to crown.
Okay, crown. In the dental context, a crown has two primary meanings, and the sources touch on both.
Two meanings.
Yeah. First, there's the anatomical crown. That's the visible part of your natural tooth, the portion you see above the gum line. It's covered in enamel.
Right, the top part.
Exactly. Below the gum line is the root, anchored in the bone. Second, and relevant to Gary's situation, crown also refers to an artificial restoration.
Like a cap.
Precisely. If a tooth is severely damaged by decay, fracture, or if the tooth has had extensive work done, like a root canal, a dentist might recommend covering the entire remaining natural tooth structure with a custom-made cap or crown.
Okay.
This restoration is designed to look and function like a natural tooth, covering and protecting the weakened structure underneath. Crowns can be made from various materials like gold, porcelain, often preferred for front teeth due to aesthetics, or ceramic composites.
Got it.
The sources describe an artificial crown as being akin to a very large, comprehensive filling that covers the entire biting surface and sides of the tooth above the gum line.
So Gary's was loose.
Right. In Gary's case, his existing artificial crown was loose and needed to be refitted, meaning securely rebonded or cemented back onto the tooth structure it was designed to protect.
That makes the distinction very clear. And finally, filling, which is often paired with the word cavity.
A filling is a material used by a dentist to repair a tooth damaged by a cavity. Once the decayed portion of the tooth is cleaned out, a filling material is used to fill the resulting hole.
Fills the hole. Makes sense.
Yep. This restores the tooth's shape, function, and integrity, preventing further decay from progressing into the tooth. Common filling materials include dental amalgam, the silver-colored ones, a composite resin, which is tooth-colored, porcelain, or sometimes gold. The process usually involves cleaning out the cavity, then placing a material, often starting as a paste or malleable substance, which is then hardened or set, becoming strong and durable, essentially filling and sealing the cavity.
Okay.
One anecdote shared was someone who had numerous fillings from childhood, openly admitting they weren't the best toothbrusher back then.
Relatable for some, I'm sure.
Again, highlighting the direct link between oral hygiene habits and the need for restorative procedures like fillings.
Understanding these terms definitely makes you a more informed participant in your own dental care. You're not just hearing sounds, you understand what the dentist is diagnosing and recommending.
Exactly. It turns the visit from a mysterious procedure into something you can actually follow and engage with.
Moving beyond the specifics of a single visit with problems, let's talk about the fundamental role of dentists in our healthcare system. They are highly trained professionals, and their job encompasses far more than just fixing teeth when they hurt.
That's a crucial point. The sources define a dentist as a healthcare professional who specializes in the diagnosis, prevention, and treatment of diseases and conditions that affect the teeth, gums, jaw, and mouth.
So diagnosis, prevention, and treatment.
Right. Their core mission is really twofold: to help people maintain excellent oral hygiene and to prevent serious health conditions that can either originate in the mouth or manifest there due to systemic issues.
And it's increasingly understood that looking after your mouth isn't just about keeping your smile aesthetically pleasing or being able to chew comfortably.
Not at all. The sources emphasize the deep connection between oral health and overall systemic well-being. The mouth is often referred to as a gateway to the rest of the body.
A gateway, how so?
Well, problems in the mouth, particularly infections and inflammation, can have far-reaching effects on general health. Bacteria from gum disease, for example, can potentially enter the bloodstream and contribute to other health problems elsewhere in the body.
Wow, okay.
This is why regular dental visits are highlighted as being important for your overall well-being, not just your oral health in isolation.
So digging a bit deeper into why dentists are crucial, beyond the general idea of prevention, what are the specific key reasons mentioned?
Firstly, they're absolutely vital in preventing tooth decay. While brushing and flossing at home are your daily defense, dentists provide professional protection. This includes thorough professional cleanings that remove plaque and hardened tartar calculus that you just can't get rid of with a brush alone. They can apply fluoride treatments to strengthen enamel and provide personalized advice on brushing techniques, flossing methods, and even diet, all aimed at protecting your teeth from acid attacks and cavity formation.
So they're working to stop problems before they start or catch them at the earliest stage. What else?
They play a critical role in treating gum disease. Gum disease, which starts as gingivitis, inflammation of the gums, and can progress to the more serious periodontitis, is a major cause of tooth loss in adults.
Periodontitis. That sounds serious.
It is. It involves infection and inflammation spreading below the gum line, damaging the bone and tissue supporting the teeth. Dentists are trained to identify the early signs of gum problems during routine checkups, often before you notice symptoms yourself.
Oh, that's important.
Very. And they provide treatments to manage the infection and inflammation, keeping your gums healthy and preventing the irreversible damage that leads to teeth becoming loose and eventually being lost.
They also fix things when damage has occurred.
Yes. Fixing broken or damaged teeth is another essential function. Whether a tooth is chipped in an accident, fractured, or severely weakened by decay, dentists can repair it using various techniques like bonding, veneers, crowns, or even performing extractions if necessary.
Right.
Restoring damaged teeth is crucial for maintaining proper chewing function, preventing misalignment of other teeth, and preserving the appearance of your smile.
And the aspect that impacts how people feel about themselves.
Improving smiles through cosmetic dentistry. While perhaps not strictly medically necessary in all cases, procedures like professional teeth whitening, veneers, and working with orthodontists on braces or aligners help correct aesthetic issues.
Sure.
The sources acknowledge this role, highlighting that helping people feel confident about the appearance of their smile is a significant part of a dentist's work, impacting a person's self-esteem and social interactions.
And finally, perhaps one of the most critical, potentially life-saving functions.
This is perhaps the most impactful point often overlooked. During a routine checkup, dentists examine not just your teeth and gums, but your entire oral cavity: the tongue, cheeks, throat, floor, and roof of the mouth.
That whole thing.
The whole thing. They are trained to look for any abnormal lesions, lumps, or discolorations that could be early signs of much more serious conditions, such as oral cancer.
Wow.
They can also identify signs of infections that could spread systemically or spot indicators of other health problems that might first show up in the mouth, like signs related to diabetes or nutritional deficiencies. Early detection of these conditions, often by a dentist during a regular visit, can be absolutely crucial for successful treatment and long-term health outcomes.
So it's clear a dentist is far more than someone who just drills and fills. They are detectives and guardians of a critical part of our overall health landscape.
They truly are. Their expertise bridges oral health and systemic health, making their role fundamental to comprehensive well-being.
Now, let's make it really practical. If you're feeling that anxiety we talked about earlier, understanding exactly what happens during a typical regular checkup can help alleviate some of that fear. Let's walk through the steps you might expect.
Knowledge really is power when it comes to managing anxiety, and knowing the predictable sequence of a dental checkup can make a big difference.
What's the very first thing that usually occurs after you're seated?
It begins with a thorough examination. The dentist, or most often a registered dental hygienist first, will carefully inspect your teeth, gums, tongue, cheeks, and the rest of your mouth.
Okay.
They use that small dental mirror and a probe, which we'll discuss in more detail, to check for any visual signs of decay, assess the condition of your gums for signs of inflammation or recession, and look for any other abnormalities or changes in your oral tissues since your last visit.
Checking everything out.
Exactly. They might also measure the pockets around your teeth to assess gum health.
And if they need to see below the surface,
That's when x-rays are taken, but only if needed based on your individual history and what they see during the visual exam, or sometimes on a set schedule like once a year or every 2 years.
right, not always every visit.
Not always. As we discussed, x-rays are crucial for detecting problems that aren't visible to the naked eye. This includes cavities forming between teeth, infections at the tip of the tooth roots, bone loss due to gum disease, or issues with developing or impacted teeth like wisdom teeth. They provide a complete picture of what's happening beneath the surface.
After the examination, often comes the part that leaves your mouth feeling sparkling clean.
The professional cleaning, usually performed by the dental hygienist, this is a crucial step.
The scraping part.
Yeah, that's part of it. They use special instruments like scalers to meticulously remove plaque and tartar, which is hardened plaque, from the surfaces of your teeth, both above and below the gum line. Plaque is a sticky film of bacteria that constantly forms on your teeth, and if not removed, it hardens into tartar. Both plaque and tartar are major contributors to cavities and gum disease because they harbor bacteria that produce harmful acids and toxins.
Right.
Regular professional cleaning removes this buildup in areas your toothbrush and floss simply cannot reach effectively.
And sometimes there's a step to give your teeth extra protection.
Yes, following the cleaning, some dentists will apply a fluoride treatment. This is particularly common for children, but is also beneficial for adults, especially those prone to cavities or with sensitive teeth.
Why fluoride?
Fluoride is a mineral that helps strengthen tooth enamel, making it more resistant to the acid attacks from bacteria that cause decay. It's applied topically, often as a varnish, foam, or gel.
Okay, good to know. And finally, you get your marching orders for home care.
Exactly. The dentist or hygienist will provide personalized advice on how you can best care for your teeth and gums at home between visits.
Like how to brush better.
Yeah, maybe demonstrating proper brushing technique, explaining the most effective way to floss, often showing you with models, or pointing out specific areas in your mouth and giving recommendations on diet, oral hygiene products, or any other habits that might be affecting your oral health. This customized guidance is key to maintaining the benefits of the professional cleaning and preventing problems.
So the ultimate outcome of going through these steps regularly.
The sources highlight that regular checkups are the most effective way to detect any problems at their earliest stages. When caught early, issues like cavities or gum disease are usually much simpler, less invasive, and less expensive to treat.
Catching it early is key.
Absolutely. This proactive approach prevents minor issues from escalating into painful, complex, and costly problems down the line. The material also notes that while dental anxiety is real, modern dentistry utilizes techniques and anesthetics to make most procedures, including regular checkups and cleaning, as comfortable and painless as possible.
It sounds like an investment in your future comfort and health.
Absolutely. Prevention and early intervention are always the best path in dental care.
Now let's zero in on some of those common dental problems people experience and, perhaps more importantly, how the daily habits we just touched on are your most powerful tools in fighting them off.
These common dental woes affect a huge number of people, but the good news, as the sources point out, is that many are largely preventable or manageable with consistent care.
We've already mentioned cavities. Let's revisit them briefly.
Cavities, or dental caries, are probably the most common issue. As we discussed, they are holes caused by the acid produced by bacteria breaking down tooth enamel and dentin.
The acid attacks.
Right. If not filled, they grow larger and can eventually reach the tooth's nerve, causing pain and potentially leading to infection or tooth loss. Fillings are necessary to restore the tooth's structure and function after the decay is removed.
And then there's the issue that affects the support structure of the teeth. Gum disease.
Gum disease is an inflammatory condition affecting the tissue surrounding and supporting your teeth. It starts with gingivitis, characterized by red, swollen, and sometimes bleeding gums, usually caused by plaque buildup along the gum line.
Gingivitis. I've heard of that.
Yeah, it's the early stage. If gingivitis isn't treated, it can advance to periodontitis. In this more severe stage, the inflammation spreads below the gum line, causing the gums to pull away from the teeth, forming pockets, and the infection begins to destroy the bone and connective tissue holding the teeth in place.
Oh, that sounds bad.
It is. This destruction is often painless in its early stages, which is why regular dental checkups are crucial for detection. Periodontitis is a major cause of tooth loss in adults and has also been linked to other systemic health issues like heart disease and diabetes.
There's that link again.
Exactly. Highlighting that oral health connection again.
What about that jolt of pain when you eat something really hot or cold?
That's tooth sensitivity. The sources explain this can happen when the enamel layer on your teeth wears down or the gums recede, exposing the underlying layer called dentin.
Dentin.
Yeah, dentin contains microscopic tubules that lead to the nerve at the center of the tooth. When this protective layer is compromised, stimuli like hot, cold, sweet, or acidic foods and drinks can reach the nerve endings through these tubules, causing that sharp, often sudden pain.
What causes that wear?
It can be caused by brushing too hard, gum recession, teeth grinding, or even cavities.
And an issue that affects social comfort.
Persistent bad breath, medically known as halitosis. The sources list several causes. Most commonly, poor oral hygiene, food particles, and bacteria left in the mouth decay and produce foul-smelling gases.
Yikes.
However, it can also be a symptom of gum disease, dry mouth infections, or even systemic conditions. Lifestyle factors like smoking, chewing tobacco, and certain foods or drinks like garlic or coffee are also significant contributors. It's an issue that can significantly impact a person's confidence and social interactions.
Back to those wisdom teeth we talked about earlier.
Yes, wisdom teeth problems. As they are the last teeth to come in, there's often insufficient space in the jaw. This can lead to them becoming impacted, meaning they only partially erupt or don't emerge at all, remaining trapped beneath the gum or bone.
So teeth.
Pretty much. Impacted wisdom teeth can cause pain, infection, damage to neighboring teeth, or lead to cysts. Even if they erupt fully, their position far back in the mouth can make them difficult to clean, increasing the risk of cavities and gum disease around them.
And finally, teeth that aren't perfectly straight.
Crooked or misaligned teeth, also known as malocclusion. People seek treatment for misaligned teeth not just for cosmetic reasons, but importantly, for functional ones.
Functional reasons.
Yeah. Crooked teeth can be harder to clean effectively, increasing the risk of cavities and gum disease. They can also cause issues with your bite, leading to problems with chewing, excessive wear on certain teeth, or even jaw joint pain, TMJ disorders. The common treatments involve orthodontics, using devices like traditional braces or clear aligners to gradually move the teeth into proper alignment, improving both function and appearance.
So these are the potential problems. Now, let's reinforce how you can actively work to prevent many of them every single day. The sources outline key habits.
Taking care of your teeth at home is the absolute foundation of good oral health. The first and most fundamental habit is brushing.
How often and with what?
The recommendation is clear. Brush your teeth twice a day. Use a fluoride toothpaste. Fluoride is your enamel's best friend in fighting decay.
Right, fluoride.
And a toothbrush with soft bristles to avoid damaging your gums and enamel. The technique matters. You need to clean all surfaces of every tooth, including the front, back, and chewing surfaces, using gentle, circular, or back-and-forth strokes along the gum line. The goal is to remove plaque and food particles thoroughly.
And for those tight spots between teeth.
That's where flossing is indispensable. The sources recommend flossing daily. Brushing alone only cleans about 60% of the tooth surface.
Only 60%? Wow.
Yeah. Flossing is the most effective way to remove food debris, plaque, and bacteria from the spaces between your teeth and along the gum line, areas where cavities and gum disease often start. Skipping flossing leaves these areas vulnerable.
Diet also plays a significant role.
Absolutely. What you eat and drink has a direct impact on your oral health. The sources advise avoiding sugary foods and drinks, especially frequent snacking or sipping. Sugar feeds the acid-producing bacteria in your mouth.
Less sugar, fewer problems.
Basically. Limiting sugar intake reduces the fuel source for these harmful bacteria. Conversely, including foods rich in calcium and phosphorus, like dairy products, milk, cheese, yogurt, leafy greens, spinach, kale, and nuts, can help strengthen tooth enamel.
And a simple, often overlooked habit.
Drinking plenty of water throughout the day. Water helps rinse away food particles and sugars from your teeth and gums. It also helps maintain saliva production.
Saliva is important.
Crucial. Saliva acts as a natural buffer, neutralizing acids and containing minerals that help remineralize, strengthen tooth enamel. Staying hydrated supports your mouth's natural protective mechanisms.
Certain habits should also be avoided.
The sources clearly link smoking and excessive alcohol consumption to significant oral health risks. Smoking dramatically increases the risk of gum disease, slows healing in the mouth, causes bad breath and staining, and is a major risk factor for oral cancer.
Big risks there.
Huge. Excessive alcohol consumption can dry out the mouth, reducing protective saliva flow, and is also linked to an increased risk of oral cancers, particularly when combined with smoking. Avoiding these habits is critical for long-term oral and overall health.
And finally, bringing it back to the professional care.
Visiting the dentist regularly. The standard recommendation is a checkup and professional cleaning every 6 months, though your dentist might suggest a different frequency based on your individual risk factors.
Right, it can vary.
It can. These regular visits allow dentists to monitor your oral health, catch problems like cavities or gum disease in their earliest, most treatable stages, and provide professional cleaning that you cannot replicate at home. It's the vital professional partner to your daily home care.
So it's a combination of consistent, diligent care at home and regular professional oversight that forms the strongest defense against most dental problems.
Precisely. They are two sides of the same coin when it comes to maintaining a healthy mouth for life.
Now, the world of dentistry isn't monolithic. Just like in medicine, there are different areas of focus and specialization. Dentists wear many different hats depending on the type of care you need.
That's right. While your general dentist is your primary care provider for most routine needs, there are specialists who have undergone additional training to treat more complex or specific conditions.
Who is the dentist most people interact with regularly?
That would be the general dentist. They are the foundation of dental care, providing a wide range of services including routine checkups, professional cleanings, often performed by a hygienist in their practice, fillings, extractions, root canals, and crowns.
The main point of contact.
Exactly. They're responsible for your overall oral health maintenance and referring you to specialists when needed.
What about dental care specifically tailored for younger patients?
Those are pediatric dentists. They specialize in the oral health of children from infancy through adolescence.
Kids dentists.
Right. They are trained to handle the unique dental development of children, address common childhood issues like cavities and teething discomfort, and importantly, create a positive and comfortable environment for young patients, helping them establish good dental habits early on.
For correcting smiles and bites.
You'd see an orthodontist. They specialize in diagnosing, preventing, and treating dental and facial irregularities, specifically focusing on aligning teeth and jaws.
Braces and aligners.
That's their main toolkit. They use various corrective appliances, most famously braces and clear aligners, to move teeth into proper positions, improving bite function and facial aesthetics.
Experts in the tissues surrounding the teeth.
Those are periodontists. As we discussed gum disease, periodontists are the experts in treating diseases and conditions affecting the gums and the underlying bone that supports the teeth.
So they handle the serious gum stuff.
Exactly. They handle more advanced cases of gum disease, perform procedures like scaling and root planing, deep cleaning, gum grafting, and place dental implants.
If a problem is deep inside the tooth, in the pulp.
That's the realm of the endodontist. They specialize in the tissues inside the tooth, known as the dental pulp, which contains nerves and blood vessels.
Root canal.
That's their most common procedure, yes. The root canal treatment, where they remove infected or inflamed pulp from the root canals of a tooth, clean and disinfect the inside, and then fill and seal the space to save the tooth.
What if someone is missing one or more teeth?
You would likely be referred to a prostodontist. These specialists are experts in restoring and replacing missing teeth and other oral structures.
Like dentures and implants.
Yes, they design, fabricate, and fit artificial replacements like dentures, full or partial, bridges, which span the gap created by missing teeth, and dental implants, artificial tooth roots, surgically placed in the jawbone to support crowns or bridges. Their work restores both function and aesthetics.
And finally, for more complex surgical procedures.
That falls to the oral and maxillofacial surgeon. These specialists are trained to perform a wide range of surgical procedures involving the mouth, jaw, face, and neck.
So more than just teeth.
Much more. This includes complex tooth extractions like impacted wisdom teeth removal, corrective jaw surgery, orthognathic surgery, placement of dental implants, treatment of facial trauma and fractures, and surgical treatment of oral pathology like cysts and tumors.
It's impressive how specialized the field is, ensuring that virtually any issue can be addressed by someone with focused expertise.
It really highlights the complexity of the oral and facial anatomy and the diverse needs patients can have.
Let's shift gears slightly and talk about the tools of the trade. For some people, the sight or even just the sound of certain dental instruments can heighten their anxiety. Understanding what they are and what purpose they serve can make them feel a bit less intimidating.
That's a great point. The tools aren't there to scare you. They're essential for diagnosis, cleaning, and treatment. Dentists use a variety of instruments precisely designed for working in the relatively small and complex space of the mouth.
What are some of the most common ones you'll see on the tray?
Probably the most ubiquitous is the small dental mirror. It's attached to a handle and allows the dentist to see surfaces of your teeth and mouth that are otherwise hidden from view.
Like the backs of teeth.
Exactly. The backs of teeth, behind molars, and other awkward angles. It's also used to reflect light onto areas being examined.
Then there's that slender, often pointy instrument.
Yes, the Explorer, also sometimes called a probe, though periodontal probes are slightly different. The Explorer is a thin, flexible instrument with a sharp point.
What's it for? Poking.
Gently exploring, yes. Dentists use it to gently explore the surface of your teeth, feeling for the texture of the enamel. They can detect soft spots, pits, or fissures that might indicate the beginnings of a cavity or other surface irregularities that aren't immediately obvious just by looking.
For the cleaning portion, what's typically used to get rid of buildup?
That's where scalers come in. There are different types, but they are designed with various shapes and angles to fit around teeth surfaces. Hygienists use scalers to carefully scrape away the plaque and tartar buildup that accumulates on teeth, both above and below the gum line.
The scraping noise.
Yeah, that's the scaler at work. This is a mechanical process necessary because tartar is too hard to remove with brushing or flossing alone.
During procedures, you often have something in your mouth helping keep things dry.
That's the suction device, or saliva ejector. It's a tube, usually made of plastic, connected to a suction machine. It's placed in your mouth to remove excess saliva, water used during cleaning or drilling, and debris from procedures.
Keeps the area clear.
Exactly. Keeping the area dry and clear is crucial for the dentist to see what they're doing, and for materials like fillings or bonding agents to adhere properly.
And the tool most associated with that distinct sound.
That would be the dental drill, or more technically, the dental handpiece. Modern drills are high-speed rotating instruments fitted with burrs, small drill bits.
What do they do?
They are used primarily to remove decayed tooth material when preparing a tooth for a filling or crown, or to shape tooth structure. While the sound can be anxiety-provoking for some, the technology has advanced significantly, making them faster and more efficient than older versions.
And the imaging equipment we mentioned earlier.
The X-ray machine. This equipment takes radiographic images of your teeth, roots, and jawbone. As we discussed, these images are vital for diagnosing hidden issues like interproximal cavities between teeth, root infections, bone loss, impacted teeth, and developmental abnormalities that cannot be detected during a standard visual examination.
An essential tool.
An indispensable diagnostic tool, absolutely.
It's reassuring to know the purpose behind each tool, taking away some of the mystery. And it sounds like the tools themselves are constantly improving.
Absolutely. Dentistry is a field that embraces technological advancements. New tools and materials are continuously being developed with the aim of improving the precision of diagnosis and treatment, reducing patient discomfort, and enhancing the long-term success of dental work.
Speaking of advancements, let's look into the crystal ball. The sources touch on how dentistry is changing, hinting at some exciting possibilities for the future of oral care.
Dentistry is indeed a dynamic field, constantly evolving with new technologies and research. The future promises treatments that are less invasive, more efficient, and perhaps even more comfortable.
What are some of the trends highlighted?
One significant area is laser dentistry. Lasers are increasingly being used for a variety of procedures, from removing decayed tooth material in cavities, often reducing or eliminating the need for a traditional drill in certain cases.
No drill. That sounds good.
Right. To treating gum disease by precisely removing infected tissue and sterilizing pockets. Lasers can mean less bleeding, faster healing, and potentially less need for anesthesia for some procedures, which is a big plus for anxious patients.
That sounds like a move towards less intimidating treatments. What else?
3D printing is having a transformative impact. Dentists and dental labs can now use 3D printing technology to rapidly create highly accurate, customized dental prosthetics and appliances.
Like printing teeth.
Sort of. Printing crowns, bridges, dentures, surgical guides for implant placement, and even orthodontic models or retainers. This technology allows for faster turnaround times, more precise fits, and potentially lower costs for certain restorations.
And for something as common as wanting a brighter smile.
Teeth whitening continues to see innovations. Researchers and companies are developing safer and more effective formulations and delivery methods for teeth whitening, both for in-office treatments performed by professionals and for at-home products.
Better whitening, less sensitivity.
That's the goal. The focus is on achieving better results with reduced sensitivity and less potential for damage to tooth enamel.
We hear a lot about artificial intelligence everywhere. How is it being applied in dentistry?
Artificial intelligence, or AI, is emerging as a powerful tool to assist dentists. AI algorithms are being trained to analyze dental images like X-rays and 3D scans to help identify potential issues with remarkable accuracy.
Like a second opinion from a computer.
Kind of, yeah. Sometimes spotting problems that might be missed by the human eye alone, especially in complex cases. AI can aid in diagnosing cavities, gum disease, bone loss, and even identifying pathology. It's also being used in treatment planning, helping dentists predict outcomes and select the most effective approaches for individual patients.
So it's a helper, not a replacement.
Exactly. It's augmenting their diagnostic and planning capabilities.
And the trend, that sounds like something out of science fiction.
Regenerative dentistry. This is a fascinating area of research focused on developing techniques to repair, replace, or regrow damaged or lost tooth structure and tissues.
Regrowing teeth. Seriously.
Well, scientists are exploring ways to stimulate the tooth's natural ability to repair dentin, regenerate damaged tooth enamel, or even bioengineer entirely new teeth or tooth components using stem cells and biomaterials. While some applications are still in early stages, the potential to move beyond simply repairing damage to actually regenerating healthy tissue is incredibly exciting.
These future trends point towards a dental experience that is increasingly personalized, minimally invasive, and potentially even capable of reversing damage in ways we can only imagine now.
They definitely suggest a future where dental treatments could be faster, safer, more comfortable, and lead to longer-lasting results for patients.
Despite all these exciting advancements and the best efforts of dental professionals to make visits comfortable, it's a reality that dental anxiety and fear are still very prevalent. It's important to acknowledge this experience that many people share.
It is indeed. Dental fear, ranging from mild nervousness to significant phobia, affects a considerable portion of the population, and it's a valid feeling.
What are some of the common reasons behind this fear, according to the sources?
A primary driver is often the fear of pain. While modern anesthesia techniques and pain management have made most procedures genuinely painless or at least manageable, the anticipation or memory of pain can be very powerful.
The thought of pain.
Exactly. The idea of potential discomfort, especially in a sensitive area like the mouth, is a significant source of anxiety.
Past negative experiences can certainly contribute.
Absolutely. A previous bad or painful experience at the dentist, particularly one that occurred in childhood when techniques might have been less refined or the patient was less able to cope, can leave a lasting psychological impact and create a strong aversion to future visits.
And sometimes it's simply the environment or the tools themselves.
For many people, the sight of specific dental instruments like needles used for local anesthetic or the distinctive high-pitched sound of the dental drill can trigger significant anxiety responses even before any procedure begins.
The sound alone.
Yeah. The tools themselves become symbols of potential discomfort or invasiveness.
And the feeling of vulnerability in the chair.
That's the aspect of loss of control. Lying back in a dental chair, often unable to speak clearly or move freely with instruments in your mouth, can make some people feel vulnerable and powerless over the situation. This feeling of not being in control is a significant contributor to anxiety for many patients.
So if you experience dental fear, what strategies does the material suggest for managing or overcoming it?
One key strategy is open communication. Talk to your dentist about your fear. Don't hesitate to tell them you're nervous, explain your specific concerns, and ask questions about the procedure.
Just be upfront about it.
Exactly. A good dentist will take your anxiety seriously, explain everything they are doing step by step before they do it, and work with you to make the experience more comfortable, perhaps offering options like nitrous oxide, laughing gas, or sedation dentistry, if appropriate. Feeling informed and heard can greatly reduce anxiety.
Simple relaxation techniques can also be surprisingly effective.
Yes, techniques you can practice even while you're in the chair. Deep breathing exercises focusing on slow, controlled breaths can help calm the nervous system.
Like meditation breathing.
Kind of, yeah. Listening to calming music or an audiobook through headphones can provide a distraction from the sounds and sensations of the dental office. Sometimes, simply visualizing a peaceful scene can help redirect your mind away from the anxiety.
And finding the right dental professional seems crucial.
It really is. Some dentists are particularly skilled and experienced in treating anxious or phobic patients. They might use specific techniques, take extra time to explain things, employ different sedation options, or simply have a naturally gentler approach.
Seeking out the right fit.
Absolutely. Seeking out a dentist who is known for being good with nervous patients can make a world of difference in your experience and help you build trust over time.
These are actionable steps that can truly help someone navigate dental fear.
They provide a pathway to making necessary dental care less stressful and more manageable.
Before we wrap up this deep dive, we have a unique and rather surprising anecdote from the sources that really illustrates just how varied dental experiences can be around the world.
Ah, yes. This story comes from an experience someone had while traveling in Cambodia.
What happened?
The account describes chipping a tooth quite unexpectedly. The person was eating some local food, and the detail is that it was specifically dog meat.
Oh, wow.
And they bit down hard on a hidden bone within the meat. To add to it, this was a tooth that had actually been chipped before, so it was already potentially weakened.
Ouch. A painful and surprising encounter. And this required seeking dental treatment while in Cambodia.
Yes, the chip was significant enough that it necessitated finding a dentist there to get it fixed.
And what was the remarkable outcome of this visit?
The most striking detail highlighted in the source is the cost of the treatment. A new crown was made for the tooth. It wasn't made of traditional materials like gold or porcelain, but rather a type of paste that was placed and then hardened, blending in and looking quite normal.
A paste crown.
Apparently. And the total cost for this restoration, a mere $10.
$10. For a crown, that is an incredibly low figure, especially when compared to typical dental costs in many Western countries, where a crown can easily cost hundreds or even thousands of dollars.
Exactly. It's a vivid illustration of the vast differences in healthcare costs, practices, and material availability that can exist across different parts of the world.
Amazing difference.
Yeah. The anecdote also included a slightly humorous detail about the dentist they saw appearing incredibly young, looking perhaps only 19 years old, although they stated they were 30. The speaker in the story mentioned their trusting nature in proceeding with the treatment despite this initial impression, and ultimately the inexpensive crown served its purpose. It's a memorable tale that underscores the global variation in dental care experiences, cost, and accessibility.
A truly surprising nugget found within the material.
Yeah.
So we've really taken a comprehensive deep dive today. We've used a real-world scenario to understand the basic flow of a dental visit, decoded some common and important dental terms, explored the absolutely vital role dentists play in our overall health, walked step by step through what happens during a regular checkup, discussed the common problems people face, and crucially, the essential daily habits that fight them. Looked at the different types of dental specialists who handle specific needs, gotten familiar with some of the tools used in the dental office, peered into the exciting future of dentistry with emerging technologies, and candidly addressed the common issue of dental fear, offering practical strategies to manage it.
The overriding message reinforced throughout the material is clear. Maintaining good oral health isn't just about having a nice smile, it's fundamental to your general well-being.
Absolutely.
This is achieved through a combination of consistent, diligent care at home, brushing twice a day, flossing daily, eating mindfully, staying hydrated, and avoiding harmful habits, and partnering with a dental professional through regular checkups, ideally every 6 months.
The partnership is key.
It really is. While dental anxiety is a real hurdle for many, understanding the process, communicating your fears, and seeking out a comfortable environment can make a significant difference. Modern advancements are continuously making dental care more effective and less uncomfortable than ever before.
By becoming more informed about what happens in the dental chair and understanding the why behind the recommendations, you are better equipped to take proactive steps towards not only a healthier mouth, but a healthier you, and hopefully approach that next appointment with a little less apprehension.
It's an investment in your long-term health and comfort, truly.
And as we wrap up this deep dive, here's a thought to leave you with, building on everything we've discussed today. Considering the incredible pace of technological change, we touched on things like AI becoming diagnostic aids and the potential of regenerative dentistry to regrow tissue. How might our relationship with dental care fundamentally transform over the next decade? Will the experience look completely different?
Interesting question.
And thinking about the human element, the anxiety many feel, what single small step could you take right now to feel even just 1% more at ease during your very next dental appointment? Something to chew on until our next deep dive.